So Clear Vision Club, Clear Vision Club on Clear Vision Wednesday, super excited to be here today. I am Claudia Mühlenweg and I am the host of this podcast, as it's called. And my guest today is very, very special, dear friend of mine. And I'm so excited for this presentation called Confessions of an Eye Doctor. And Dr. Radka Toms is an ophthalmologist and a functional medicine practitioner. And she wants to share with us why or how she changed her own belief system and what happened. And Radka, I bring you on stage because I feel like you can much better tell your own story than me doing that. So welcome, first of all.
Yeah, hi, everybody. I'm so happy to be here, Claudia. Thank you for inviting me.
So yeah, tell us a little bit about, like, you know, because we had talked, right? And I thought, like, this is perfect title, Confessions of an Eye Doctor. Like, share a little bit about your own story and why you feel like you literally have to make some confessions here.
Yeah, so that's great. Yeah, it's basically like most of the functional medicine doctors, we find a new way of seeing the medicine through our health story, and it was for me too. Because I was working too much as a resident. I was working around the clock, and I loved ophthalmology always. I used to work in Prague, and then in Czech Republic, and then in the UK, where I did my residency, and was working doing cataract surgery. My subspecialty is glaucoma, cornea. I did PhD. I didn't finish it because we were moving around the world, but I loved the research, and so I was really working. I didn't, of course, in medical school, we don't talk about food, we talk about vitamins, but we don't really talk about how important nutrition is. And so as everybody else in the medical field, I really didn't take care of myself. And then I developed inflammation and rosacea. And that was when my daughter I was home with her. And so I was Googling, how can I get rid of this skin disease? Because doctors told me that I will need to take medication for a long time. And the same thing was that every time I had rosacea patient, ocular rosacea, I would say the same. You have to take antibiotics for a long period of time. So I said, oh my gosh, I have to do it now. So I started Googling, and just by coincidence, I found this research paper from now really very known Professor Lustig from California. And it was about sugar and inflammation. And it was, just remember, it was 11 years ago, which we didn't have a clue. Like we know now, we have so many studies since then about, like, there is no question sugar is really bad, and in high amount it's really deteriorating our health in many ways. And I was thinking, wow, that might be me, because I was literally hooked on sugar. I was having chocolate because patients always bring the chocolate to our practice. So, you know, when you don't have time to eat, you just have a chocolate. So that was my first aha. And then second was through him, basically following because he's big as a pediatrician, and his studies could show that if we change here in America, in California, the kids in 10 days, when they change the sugar to a different type of food, they could see that a liver enzyme just improve the liver function, improve in 10 days. And I was, wow, this is amazing. So I started just studying everything about sugar. And I said, how I stop it? I couldn't stop, of course, because I was highly addicted. So it was like all learning about myself. And then I found Mark Hyman. And then when the threat to functional medicine really started, and I started learning all about gut microbiome, because that's new. Of course, Hippocrates said thousands and thousands years ago that all diseases begins in the gut. And we have some idea about gut flora, but we know much more today about how it's, even today, I want to share with you how the emerging science is showing us how it's linked to the eye. That's basically, I want to shed a little bit of light. And that's why I said, wow, I have to, of course, I do my work as ophthalmologist. I do cataract surgery. I of course, administer treatment for patient has glaucoma and all these things, but we can do so much more beyond my doctor's office. So I started really educating people. Just, still, I feel like if I say too much, I will not practice like artist. So I have to be really careful. I just always give food to eat, food not to eat, and some recipes for people who are interested. And of course, in 10 minutes, doctor's appointment that we have for patient, I didn't have enough time. So I had one, that was my second aha moment when I said I have to really work on that more, because I had one patient, and I see many diabetics as well in the medical retina clinics, and these patients have diabetic retinopathy, which is the like complication from diabetes. And there are various stages of diabetic retinopathy, and we treat it either with injections or with laser or with various things. And I have this patient, he was very interested in this nutrition. So I just keep telling them what to do, what not to do. You have to take off the sugar. First, of course, like, oh, like everybody, oh. And then I tell them no breads, oh. So, but it's the high glycemic food. It's all that. And I forgot, of course, about him. And he came back in 6 months. And he lost massive weight. His diabetes really improved, and his the high blood pressure tablets, I think he was on half dose. And I was like, wow, what did you do? This is amazing, because you don't see this normally in like practice. And he said, well, I did what you told me last time. And I was just paralyzed. And that was the moment when I said, wow, I have to do this more beyond my practice. And that's why I really said, okay, I'm doing this. I help people. That's why I opened the company, My Sugar Stop. And because it started basically finding myself and how I recognize that many people have the same problem like me. They are hooked on sugar. And so, and that's where it started. And now we did the full circle, because we know that that eye is really, we have studies actually. I will have some study suggestion. We can add it in the notes. There are various studies that can show us that the eye, it's linked, associated with gut microbiome alteration. It's associated with when we have a high fat diet, high sugary diet, we have more risk to AMD, like age-related macular degeneration. There is one paper actually, they show that, so there was on rodents, showed on rodents, and they find out that when they fed the mice with a high glycemic, high fat diet, the AMD got worse. And when they did the fecal transplant to that mice, they were able, with good microbiome, they were able to, if they changed the food to more less glycemic diet, they were able to reverse it. So these studies, and now this as well, what I found last week is about the gut bugs. We have now more idea that we can really specifically tell from what is in your stool that the people have either diabetic retinopathy or diabetes, or they are just control study. They differentiate so much, which is really, it's we now it's not everything black and white. It's all that's emerging, but I love to tell you today a little bit about leaky gut and about gut microbiome itself. I have some examples here how to improve it. And because really this is the future. If someone wants as well, another article that I will attach is from the American Academy of Ophthalmology, is the gut and the eye. If someone wants to really know but more, because we have 45 minutes, but it's something that really excites me, because I see it. I'm sure you see it as well, how much people can change with lifestyle change, right? You teach something else. I believe that every ophthalmologist should do your course.
You know, I do want to actually interject just a little bit, because what you said in the beginning, first of all, I saw your Instagram post, right? And you shared about how you were just a few years ago, before you learned all this with your own health journey, that you would have like just given people the pills and said, hey, there's nothing you can do. And my second cousin is an ophthalmologist in Germany, and she's wonderful. But I asked her, like, why do you not tell people about you? And she said, you know, well, people don't want to hear that. And, you know, like you said, we have like, I don't know, 5 or 10 minutes per patient. It's like quick. But I feel like I said to her, well, you know, but at least you can make suggestions. And either, like, that's what I feel like. I share my method, and some people are like, oh, I don't care, whatever. And other people, you know, it falls on good, like people want to know more. And the example of the man that you shared, right? You already influenced one life. You prevented somebody from becoming blind when, most eye doctors would just be like, well, that's just age, there's nothing you can do or whatever. So I feel that's so powerful that you now have this, like, I feel like we all ophthalmologists should not just do my course, that would be great, but also learn about all the things that you discovered because of your own health, right? And so I find that really fascinating that you kind of fessed up on that Instagram, like, hey, like a decade ago, I would have said, oh, that's not important. That doesn't make any difference, right?
Yeah,
so,
that's
yeah,
actually,
anyway.
I want to just mention one thing, but we cannot like push more work on ophthalmologists because we're doing
Right.
great work. This is my passion, and it's like it's unique to me. And I know few ophthalmologists that are doing similar things. That really, I can count them on one hand. But you remind me of one thing that really changed completely my paradigm, how I will practice when I go back to ophthalmology now next year, is that so the quickest appointments in practice is, for example, early diagnosed diabetics. And we will do the scan, we will do the examination, and we would just say, oh, okay, you don't have diabetes yet in the eye. See you next year. Or we send them back to, and these are the patients or people who we should spend time and tell them, explain to them that, okay, now you're on a crossroad. You either develop fully blown diabetes if they are just starting it, or you can reverse it, because now we have enough studies that you can reverse diabetes. Of course, it's much always worse reverse disease than prevent it. It's much easier to prevent disease but now studies we can prevent really with lifestyle choices, what you eat, what you think, how you behave, sleep, stress, and so on. So that's something that I will do different for sure. And I'm really so passionate because we have our hand in our, we have our health in our hand. And now, yeah, it will be another rabbit hole I would go to, but the Professor Sinclair, how he's now, shedding light on the aging, that is just a new chapter that I want to dig a little bit more. We can do that next time, because it's he was able to reverse aging in the rodents, and as well rejuvenate kind of the optic head nerve, which is envisioned in the rodent, which is something that has never been done before. So that's exciting. And all these diseases are age related. So we should be interested in this research, because if we can slow down aging, we can slow down, of these diseases. Yeah. So it's really all interesting.
And like you said, we can definitely spend like 3 hours here, but I would love to have you back. But we can also look for questions on the YouTube or on the Zoom call here, and see what people want to know about. But I think, most commonly, you talked about glaucoma, you talked about cataracts, and what can people, do, and share some of the studies. Feel free to share any studies you find useful, because I think most people that watch these videos here are already kind of very open-minded and are not like, hell, show me the science. I don't believe anything you say, but I think it's still, I'm very, as a German, we do care about science. And I think it's super important to not just say, well, I just made this up, but yeah, share with the viewers right now, unless there's questions. I don't see any questions yet. What you find is interesting to learn from the studies with the gut and the connection to eye health, and also any practical things that people can do.
That's great. Yeah, I would love to share that. So I would like to share first what is the gut microbiome, because and the leaky gut, because I'm not sure if people are familiar with that. I actually draw this picture for you to understand better. So, I mean, even if this is far away from eye, it still really influences the eye health. So it's really important to really realize how we are interconnected. So we have inside of our bodies, we have this extensive intestinal lining that's covering more than 4,000 square feet of surface area. So if you imagine this is the wall of the gut lining, which is a tube. So if you cut it, this is the wall, and this is the bloodstream. Of course, the blood is around the blood vessels that's around the gut, and the gut lining is only one layer of cells. And as you can see, it's really, they are nicely organized and they have really tight next to each other and tight barriers. So as you imagine, there is nothing coming in, or there is, but not big pieces of anything, of food or toxins, only molecules that are really go through these little tiny channels. And this is great if it stays like this, because then we have intact gut lining. And this is where the majority of immune system is, in our guts. And all these bacteria are really important for our health as well, because as we are looking to the science today, we know that they are good bacteria and bad bacteria, and they're influencing, either they fuel the inflammation while the metabolites they're creating, or calming inflammation. And these mucin layers as well, it's very important. And so when we look here, this is something that is not looking so ideal, because this is leaky gut. We said it's in the literature, it's intestinal permeability. And as you can see, these cells are not so nicely organized, and you see these large gaps, and the bacteria, the toxins, the particles that we don't want in the blood, they go through it and producing inflammation. So that's why it's we're talking so much about the gut, because it influences everything in the body. They're producing the immune antibodies, pro-inflammatory cells, and you see this mucin layer. It's usually that we have to very take care as well, because it's distorted, completely damaged, and that's what the bacteria are responsible for. Of course, there are some that we can do something already today. We always thought that if someone has leaky gut or the symptoms, it will be only linked to really gastrointestinal conditions such as celiac disease, Crohn's disease, and irritable bowel syndrome. But we found out now that the leaky gut may cause really problems as well in the body as well, and eyes as well. And so I will attach the study for that. But what I want to share with you today, that we can really work on it, and we know the factors that really they create and help us trigger the leaky gut. So what is it? Of course, sugar and processed food, because for example, emulsifiers that are in majority processed food, they have detrimental effect on the mucin layer. There's several studies to showing that. So processed food is really bad, not only for eye health, but for general health as well, obviously. And then exposure to chemicals, if you know food that they high in glyphosate as well, can have effect on leaky gut. And gluten is another one. And other grains as well, food allergies, and some as well stress actually can as well be one that cause leaky gut. And so that's what you can do today. You can start cooking your own food, and always think that food is information. Food is something that is really important for our health, because it has immediate impact on our DNA. And it's important that, so I look always at the food like this, that every mouthful, we either creating inflammation or creating healing. And so if we, take out the gluten, if we are having sensitivity, and add some really good food, as I will show you in a minute, we can really improve the leaky gut. And the gut microbiome that we call these all the bacteria, because the bugs are everywhere. They are in our eyes, in our ears, on the skin, on the head, everywhere we have some kind of bacteria. But in the gut is the majority of the bacteria, they're there. And we need the microbiome to be equipped really with healthy bacteria in order to be successfully carrying all the functions. So as the eye health is one of the functions that the microbiome, as we look into it, has. Then obviously just digestion, but as well immune response. Some of these bugs producing vitamins, they are important for detoxification. So it's really complex. And I would just want to explain a little bit. So we call it I don't want to put too many Latin names, but I just want to tell you these two because you will hear it in the future. So it's gut symbiosis is when we have a right balance of the good and bad bacteria. That's when we eat the food, the vegetables, the cooked meals and not processed food, because if we have processed food every day on our plates, we will probably most likely create gut dysbiosis. And that can be source of inflammation in a gut and throughout the body. That's what I show you when there was the other article when they were, actually, I can show you one study experiment were able to show that they have lean and obese humans and they take their feces and transplant it to mice. There was sterile mice. And they were able to create mouse that is thinner or fatter depending on whose microbiome it got. So it's something that is really it's incredible. And we know that now that there are some emerging science and they trying treat diabetes with the fecal transplant. And so this will show us really new ways of treatment as well. But as I said, always best is the prevention. So how you can really improve your gut microbiome. You cannot change from, if you are 30 years vegan, you will have certain bacteria compared to someone who is having meat all their life. Or Japanese person will have different microbiome to European or American. But because that's different, you as well inherit your microbiome from your ancestor, from your mom. But in general, we can really improve it. And that's eating probiotics, eating prebiotics. And the probiotics are the bacteria that are living in a gut. So those are either you can have supplement or you can have food, like Claudia knows because she's German. I'm sure she ate sauerkraut when she was a child, as I did. And it's kefir, it's kimchi, it's all this miso, it's all these food that's kind of a live food where is living bacteria are. These are probiotics. Kefir, yogurt, all these, and prebiotics are all these foods that have a fiber. So those are the vegetables. Those are the really either cooked or raw, but the prebiotics feeding the probiotics. So that's why sometimes people tell me I took probiotics and nothing happened. It's because if you take probiotics, you have to feed it as well with the prebiotics. And so that's a really big piece. We know that we can really feed the good bacteria and these good bacteria will produce metabolites. It calls short chain fatty acids. And these are really anti-inflammatory. So it's really, really important what we are consuming. And just to close it, that you remember a few. So it's probiotics, prebiotics, and then some collagen food like broth. So I see that people mixing bone broth with meat stock. There are the two different things, and there are two different nutrients. For the gut, it's really nutritious, the meat stock. And so sometimes people think it's like what they will cook. So any food and any meat that is humanly raised will be ideal to do that, because you will have all these collagen and it's really good for the gut lining. Of course, turmeric is another one that is anti-inflammatory. It's all very good. And then L-glutamine, that's what functional medicine teaches, and quercetin. Quercetin is something that you can take either as a supplement, or it's all the vegetables that I show you here. It's all the cruciferous vegetables like kale, broccoli, and all these. And that's for the gut microbiome and leaky gut. Of course, we can talk about what food are good for the eyesight, but if you want to really have your eye healthy a long time, because with age, we are prone to more inflammation. This will be really helpful for you if you really put the gut health in order, because we will see in the future that it's something that will be vital for not only for our overall health, but for our eye health as well, especially for these diabetic retinopathy. Glaucoma is now as well research going on, and that's linked to oral microbiome. So it's really all so interesting, but it's all starts with the gut. So, and that's when I realized that as ophthalmologist, because retina, it's such a special tissue, and it's mostly metabolically active tissue in the body because of the function. And so I realized that if I want to really help people see better, I have to help them with overall health, and that's where I'm talking today about leaky gut, because it is really, really connected. And I was so happy to see actually last week some article from Professor Spät. He's I think one of the most famous ophthalmologists, and he was saying that. Where is it? I want to show you. It's really interesting. I was so happy because sometimes I feel it's a lonely place because I'm only one who's talking about this, but he is saying here, according to Spät, it is more about enhancing one's overall health in a comprehensive sense. And he's saying financial, sexual, spiritual, intellectual, emotional, and social, than it is about vision. And I was like, oh, wow, good. It's so powerful. It's so powerful, I think. And of course, we have to take care of the eyes as you teach, absolutely. But we can do so much. And I really believe that if overall over the body is not inflamed, then it's a high chance the eyes as well will stay healthy for a very long time.
And that's why I say holistic. Sorry, I didn't in holistic vision, because what's happening is that, and again, we don't want to blame eye doctors because this is that training. They only have but it's usually, you look at this and then you look at the retina, which is, and you mentioned that too, because the retina shows us many, many diseases before they ever show up on a blood test or lab work or any other tests. But usually this is always what I usually say, because it's like, you look at this, but how this is connected to the whole body, the brain, like you said, the emotions, your mindset, what you do with your food, the gut, all of this is usually completely, ignored. And I think now we add this, you're one of the, what you call it, ambassadors or visionaries who's really, changing the paradigm in educating people about this. And I'm so happy that, you're here today in educating us, as an ophthalmologist, as a medical doctor, so anyway, keep going. And we have a few questions. Do you want me to ask a few questions and then keep going, or do you want to finish something that you wanted to share?
Sure. Yeah, sure. Let's see.
Okay, so we had some questions. First of all, about what's processed food? I mean, we all know Cheetos and Oreos and all that stuff is bad. But for instance, what about rice? Is cooked rice already a processed food, or where's the line between processed and not processed? Maybe that's a simple thing to explain.
I use really the sentence what always Mark Hyman's saying, like if it has label, it's processed. If it has no label, it's like an apple in the garden or avocado has no label. It's not processed. So rice, I think it's rice, right? It grew in the fields, so you can see it's rice. Of course, when you have products from rice, that's different. That's already processed. Right. But I would think, home cooked meals are fantastic, because then is another chapter on oils, how they are detrimenting to our health. The seed oils, that's another chapter. Like I can go on, because that was as well shown that it's really inflammatory to all over the body, as well the eyes. But really, and if you have to buy something that has a label, always look not only the breakdown, how much sugar, but look for the ingredient list. If it has, for example, I was talking about yesterday about bread, and sometimes you have the bread packaging, and it's like the whole line of like 20 or 30 ingredients. It's all chemicals. Bread is only sourdough, right? Is the sourdough yeast and water and salt. So just use common sense, and anything that has ingredients that you don't understand, you don't have in the kitchen cabinet, just put it back in the shelf. If there are some, and then sugar is another chapter as well, that I would be careful how to read this, because I'm furious now with the kids. They put no sugar, but they smartly put the apple juice concentrate. So of course it's processed and it's high. So so really just to focus on whole foods. And if you need to buy something processed, That means that has a label, it was somewhere produced, and just read the label and ingredients list. And if you understand, it's like if the, I don't know, muesli bar, so it's oats, dates, maple syrup, and I don't know what else, that's okay. You understand all of it, so it's fine. That would be my guidance, really. And it always worked well because people will see suddenly how much it's the companies are really doing great job to do good marketing. And when you twist it around and you see really what's in it, you will be amazed. Yeah.
I see that with, you know, in Germany, beer, right? I'm gluten-free, so I don't drink beer, but, you know, beer, we have the Reinheitsgebot in Germany, which is the purity law. It can only be 3 ingredients. And just something simple like tortillas, you know, if you eat corn tortillas, you know, the Trader Joe's ones have, like, I think they have corn flour, lime juice, and salt. And then you see other, you know, the popular big brands, like you said, have 20 unpronounceable ingredients to make it more shelf stable. And yeah, and oil, I'm vegan, but I always prefer the word like whole plant-based, because like you said, I eat whole plants. Anyway, we don't want to digress too much, but there's a couple more questions before you go on. So there was a question about, like, first of all, what to do with cataracts and what to do with floaters. And I would think that all of them go back to the same, fix your gut and eat proper food. But is there anything in specific about cataracts or about floaters that you can say from a holistic approach that people can do?
So I have to look for the studies if someone studying this, but I think the palming and floaters might be something that might help.
Yeah.
And with the cataracts, so I would look at this as prevention. It's amazing that we have, the phacoemulsification is the method that we use here in America and as well in Europe and the developed countries. And it's great operation because it's highly successful and we can really change people's life. But of course, you can prevent cataracts so that they appear later in life. So we know that if someone has diabetes, the cataract will appear much earlier in life. If there are cataract, if in some degenerative diseases or some genetic disease, if someone has retinitis pigmentosa, high chances that there will be cataract as well. So nothing much you can do about it. But the classic age-related cataract is back to not smoking, to go see the light, but then they're saying too much of UV, it's not good. So somewhere in between to have the light, as you saying, as Professor Huberman saying as well, but maybe if you live somewhere when it's a lot of sun during the maybe lunchtime, just protect your eyes, do some compromise, and just a healthy diet, no stress, and sleep. And I think that will be it. But of course, we have again. We have to remember that 20% of our genetics is done. So some diseases we can do much about, but 80% of our health is in our hands, and that's where the prevention lies, and that's where we can really delay the cataract. But as I said, if someone has already cataract, I would really don't be scared. The Iceland just doing great job, and is one of the most successful operation in the whole body. So I think it's good. But yeah, of course, always is good to think. And actually, I can tell you that when I was today upstairs doing something, I was thinking the dentist did a great job, because there's no discussion. Everybody knows that if you don't brush your teeth, you will have cavities. Why we don't have it with everything else in the body? Like, if you eat, sleep, no stress, you will be healthy.
I always say that when people say, "Oh, I don't have time for," everybody that knows me knows that I don't like the word eye exercises, but I don't have time. I'm like, really? Like, you don't have time, like twice a day, maybe for a couple of minutes to just, rest your eyes or do some little bit of sunning or swinging or something, really? And you're right. It's like, we don't even question that. We would look down on people like, you're not brushing your teeth. What's wrong with you? So I do have one last question before we move on, which I think could be very interesting. So Joan is asking, can we hear a little bit more about the link between oral microbiome, like the mouth, obviously, and glaucoma or microbiome, maybe in general? Is there anything that from studies?
I'm afraid it's just like few studies, and there's no direct correlation. But they wanted to find if there is certain bacteria. So if they test if they test oral microbiome, and they can predict that if someone has glaucoma or how it will be, if it will be progression or not. So it's really, we can't say much, but it's something that people doing it now, the emerging science is there, and let's see, within a few years, I think we will know more. But at this point, it's only like a spark that is there and they're doing it, but I hope that there will be more I can share next time, but at the moment it's really only on the basis. I can find a study and put it in the notes, the original study, but it's not enough to be really excited about yet. But I'm sure it will be, because, as I said, the professor Sinclair, he was able to really, the study I have here actually, it's new. I think it's June 2021. Yeah, he reversed vision loss in mouse model of glaucoma H mice, which is incredible. And I just downloaded it. So it's this study. You will have it. It's very complex.
You put them all into the show notes. Exactly.
Yeah. So it's something to think about and really be on it, because the study is so much coming, but you have to be careful because, not everything is black and white yet. That's what I would say.
But I think one thing is interesting, and because I got a call a few years ago from somebody who called me from the hospital. They had just amputated his toes, diabetes. He said he has diabetic retinopathy, he has cataracts and glaucoma. And I said he was interested in vision coaching. I said, well, considering your situation, like you would be willing to change your diet. I'm not going to work with you at all. You have to stop sugar, all that stuff. And I never heard again from him. And I'm like, I was just thinking, like, what else has to happen before, somebody is willing to give up sugar? And you know what I mean? So I think, anyway, I don't want to digress, but to me, it's like sometimes you have to, I also say diabetes is the leading cause of blindness. And not everybody gets blindness. My mom has diabetes. She takes medication. She had cataract surgeries. But sometimes you have to be more drastic and not just be, just like you said, you do this exam, come back, it'll be okay. But be like, hey, listen, you're on the road to being blind. I don't know.
It's so true. It's so true. And that's why I wanted to do all that. And I was like, well, how I do it? So that's why I have to educate myself, do the functional medicine, and become a health coach to really know how, because I was fixing people. I do fix it. As a doctor, they fix. We change the lens, but to guide, inspire, motivate people to do a lifestyle change is completely different. You have to really show them that it's possible in such a way that they will do it. And it's because we all know what we have to do, right? But it's very hard to do the transition.
Education is first, right? To me, the first thing is education. And I've talked to a lot of vision teachers over the years when I began this. I had how many times, when did people sign up to do something? They said, sometimes I talked to them 10 years ago and then they were ready, but at least to me, education, knowledge is power, right? Yes. And so I think what we're doing here is super important. And if somebody is, maybe you're not ready today, but maybe you're in a year, you're ooh, now the doctor said it's getting worse. And maybe now I want to do something.
Yes,
so
exactly.
Anyway, I don't see your questions. So keep going if you have anything else to share.
Okay. So I think it's clear that the gut, I hope, if anybody have question about that, I think it's clear the gut, the leaky gut and the gut microbiome is really important, and we have it in our hands. We can improve it. Obviously, we cannot change our whole gut microbiome, but we can improve it by growing this good bacteria and eating this lovely food. And that's really for the gut health, because we need this gut bacteria. But now I want to share with you, which is perfect because we have time. I want to share, I prepare some of this food, and which are really good for our eyes. And because we know that power is nutrition, as you said, knowledge is nutrition. So it's good to know knowledge is power. It's good to know what to eat and what to maybe add to our weekly dietary plan, because that will really help us with the eye health as well. Because if we have, so I don't have carrot here, but carrot will be super important as a group, as a carotenoids. And those are all the food that are orange. And we know that those are super important because there are a lot of studies done that effects of carotenoids on the intracellular signaling effect. So basically all these that you hear, the lutein, zeaxanthin, and that's why I have this chart for you that I will share with you later on. And this is all this food. This is carotenoids. They are really all orange, but not only orange, they as well kale, all these vegetables that are plant-based, and it's important to see plants as a medicine, because they have so many nutrients. They have polyphenols, they have phytochemicals, and these other Dr. Cara Fitzgerald, as well, functional medicine, she now published a book called Younger You, and she could find that the polyphenols in the food, especially plants, they show to be anti-aging. So, for example, she's mentioning shiitake, turmeric, all these green leaves vegetables is really important. And as I told you before, the science is showing us that we can work on the aging. So it's important to have really nutrition. So the carotenoids is one, and it's lutein and zeaxanthin. Other carotenoids, they are really abundant in macula, which is in the back of the eye. And the lutein is really rich in macula. It's 1,000 times, I think, more in macula than anywhere else as well as in the body. So it's really important to have it. There was some study as well that a boy has really a very poor nutrition. He became blind. They I think I have to find, it was some years ago, but we know that nutrition is super important as well for the eye. Especially another one is vitamin C, because vitamin C is found in every structure of the eye, and the amount in aqueous humor, which is like, this is cornea. Actually, I have the eye here. Oh, I show you.
I love that you have everything like not on the screen, but I love that you have all these like drawings. This is wonderful.
A bit old-fashioned. So this is the anterior chamber inside. So this is the cornea, this is the iris, and here everywhere is the water. And that's what they find that is really high in vitamin C. So as you can imagine, it's important because we don't know why is it important. Why is important to have the vitamin C in the eye so much. And vitamin B is another one. That's more in the fish, in the dairy, if you have, in liver, in eggs. And it's fat soluble vitamin, and it's really essential for many reactions in the body. Now, as well with COVID, we should be all having vitamin D, because we could see that there is a lot of people have low levels of vitamin D, and of course, because it's we need it as well for immune function, so it's really important. I think the dietary recommendation is age 19 until 50 years old is 600 IU per day, I think, unit. And then 600, I think it's 600 somewhere there. But you always ask your doctor, because you can test it and you will see where you stand. It's really good to be somewhere around 50. And so vitamin D is super. I'm not a big fan of supplements, but vitamin D, I would just tell everyone to take it after you check it, how much is your level. Vitamin E is another one, and that's really it's known to be, it's considered to be the most effective scavenger of free radicals. And we know that really vitamin E may decrease the risk of cataracts, of AMD. So what is the foods are important? So seeds, avocado, you will have all these, but pumpkin seeds, sunflower seeds, almonds, they are really rich in that. Zinc is another one, is trace mineral, and is really as well important because of the mechanism, how it works. It's helping, I don't want to bore you with the biochemicals, but it's just it's responsible for metabolism of in gene expression is helping as well. And as well, it was found to be protective for against development of AMD. So again, there's another one. If you want to take supplement, great. Because usually the multivitamin has as well these trace minerals as well. And then one big one big chapter are omega-3 fatty acids. We don't have time to talk about fats today, but omega-3 fatty acids are really important. It's important to have the balance between 3 and 6, because as we eating the processed food is really high in omega-6 and low in omega-3. And normally the ratio should be 3:1, and now it's 16:1. And scientists really, they suspect that this torsion ratio can be one of the most detrimental effect on our health. Of course, next to sugar, and next to epidemic of that we don't sleep enough and we stressed, but it's something that I would definitely, you can get tested, but that's as well, the studies show that it can help. And omega-3, again, it's fish or the walnuts. Of course, you can have flax seeds. I love flax seeds. I have them every single day. And then the dietary fiber, that's I mentioned it when I was talking about gut, because there were some studies that when they give mice more fiber, then I can as well find the study, where was it? Basically, they could see improvement in AMD compared to the high glycemic food, because the fiber feeds the good bacteria, the bacteria producing the short chain fatty acids, and those short chain fatty acids are really have impact on our inflammatory state, so it is decreasing it. So, and we will know more now with studies coming, how is it really, but this is all fiber. This all is fiber. Cauliflower, broccoli, this is the cruciferous vegetables full of this detoxifying phytonutrients. It's avocado, orange. Orange is, again, it's carotenoid, same like pepper, rich in vitamin C. And here you have it as well, the scale. I would suggest because when I ask people if they like kale, they say no. And because I think they're missing when they're preparing the kale, you have to massage it. Then the oil goes into the fiber, and when you massage the kale, you can make fantastic salad, or you can add it into some casserole if you want, and just make sure you really have when people starting making this change, I always tell them, so don't do something massive, because always you have to create something sustainable. So little steps, and keep going every week, every day, do little steps and be really happy for it. And so, because we know that, the big steps is something, the classic is a diet. You go on a diet, on some kind of diet. Sometimes that is important, but if you go on a diet and then diet finished in 1 month, you go back to where you were before, this is not good. We have to create something that is sustainable and that will create a good feeling, and we will be able to maintain it. And that's something that is possible, because you will love the food like this, I'm sure. And these nutrients are really important for us. As I said, vitamin C, vitamin E, vitamin D, zinc, and all these carotenoids, the lutein, zeaxanthin, and omega-3. You can have, of course, the supplements, and they all good. But so sometimes people ask me about having processed food and then supplements. Well, I don't believe in this, because we have to always have some nutrients that are coming from the food, because I told you before, food is information and has a direct impact on our gut packs, but also on our DNA. So I would encourage everyone, maybe have one green vegetables in every meal, or maybe as much as you can do. But that would be my message for everyone, because it's hard, right? It's hard to cook, it's hard to prepare meals. And there's another chapter is fasting. It's really as well shown to be anti-inflammatory. And so, but it's all incredible, and I'm happy to share that with you quickly.
I mean, this is it's such a big topic too, because over the years, I used to eat a crappy diet, even though I was from Germany. I used to smoke cigarettes. I did all these bad things, too much alcohol, all these bad things. It's never too late to make changes. And I feel, like you said, over the years, I started being vegan, but I was still eating a lot of the processed vegan, meat replacements. And over the years, you learn more and more. And then I stopped sugar, and then I stopped gluten. And, my mom is always saying like, what are you eating? I'm like, I eat thousands of plants, like all the plants on the planet. But it does require a little bit of you have to be dedicated in terms of like, I had to throw out half my cookbooks, and then I had, learning new things. But eventually, and this is what I say about vision improvement too, when they say about, I don't do any eye exercises. I had to practice initially how to use my eyes properly, versus the staring, the straining, or the bad habits. But once you learn them, like the practices help you to learn this. And when I first, worked on my nutrition and stopped sugar and did all these things, I had to relearn how to make food. But now I don't, once in a while, I'm like, oh, I want to try some cool new recipe. But I usually know now how to make these things. But initially it was like checking my blood sugar all the time, like really getting a sense like what foods raise my blood sugar. And some of them were surprising. I can eat bananas, but I can't eat pineapple. I'm like, oh, that's weird, and learning. So I think that the important message that you and I are both passionate about is like, what is your health and your eye, what is it worth to you, and yes, it's harder maybe socially, right? When I go out now, they're like, sometimes I can't eat anything at restaurants. I'm like, can you just bring me, sometimes it's just French fries, which is horrible food, but planning ahead a little bit or looking for healthier options. But sometimes it is a little bit of a challenge, or you go to a party and you bring your own food. And most of the time I find like, oh, this is yummy, this salad, who brought that salad? And they're like, oh, and then you tell them it's sugar-free and gluten-free, or you make brownies with avocados, and I use monk fruit, or like you can make really yummy food. And people are like, oh, I had no, they all think you just Bugs Bunny, you're eating raw carrots all day long. And it's like,
no. Yeah, I think people start doing it when they start feeling better and it really works. And then it's like, there's no way back. That's the magic, because I had periods, of course, that I didn't eat well. I eat well, I clean my body, and then I went for some massive work in England for months, 3 months actually. And I really didn't and I could see how I could feel not to be in tune in the body, because I was eating all this food, and of course it's influenced the metabolism and everything. And now actually, and I want to mention one more thing that you as well, I'm sure the Professor Huberman, and he was mentioning as well, we went so far now in the science that what I want to share is what he said, that our thoughts, there's some lab in Israel that our thoughts are creating, our thoughts can lead to disease or to wellness. This is incredible, I think, right? It's completely another level of thinking. But it all starts if the physical health, really, because it's only way how we can get to the emotional wellness and like, feel better about ourselves. Because if we have pain and aches, it's pretty difficult. Yeah. So, but it's wonderful, and just little steps by the time, I think, if someone wants to really improve their health and their dietary pattern, it's always to have a little bit every day. Yeah.
Yeah. So, and I think we have to come to a close. I don't see any new questions, but we can go on and on. I know I put the link into the YouTube description. You have a 5-day sugar stop. I think it's called, what is it called? Unlock your sugar.
Unlock your sugar solution. So that's where I have, that's what people who want to really change the way how they eat. And they want to, first, they always start with sugar. So that's what I teach. And it's actually running this week. So
So I put that in the chat. So that's one thing. And then we will add all the studies. And I think it's just, and I know you're going back, you told me, and I hope you can say it, but you're going back to the UK. So you will be working again as an ophthalmologist. And I think this is a very special opportunity for you too, to share this knowledge with colleagues. And, because for me, sometimes it can be scary, when I met my second cousin for the first time, that was just a few years ago. I was like, God, she's an ophthalmologist, it's kind of like, do I feel like there's this, because I have medical doctors tell me, you're a child, like what you're telling is horrible, like literally people have attacked me. And I was like, and we ended up being so much on the same page. She tries to get her, in Germany, I want to tell that story real quick. In Germany now, when you work 6 hours or so on the computer, the companies have to pay you for progressive glasses. And she tries to the people come to her, I want progressive glasses. And she's like, no, you don't want those. Those are not good for you. So she's she's like, if anything, just use cheap readers from the drugstore. I'm like, so we were like so much more in alignment, and she's in her 50s and is not really wearing glasses. And her dad was an ophthalmologist who didn't wear glasses since the 80s, mid 80s. So, which usually most eye doctors wear glasses, but I thought that was interesting. We were much more alike, than I thought. And so I'm so happy that our, ophthalmologists and medical doctors out there like you that are really passionate about changing the paradigm and educating people on their choices.
I'm happy. And you know how I got my glasses? It was really interesting because nobody in my family is myopia. Nobody from both sides. And I never really studied in school. It was always quick in elementary school and middle school. And then I came to study medicine, and suddenly I was buried in books all day long. And it was 1 year, and I got minus 50. And I said, wow, this is interesting. And I was sharing it. I was like, no, this is not possible. But now we know the studies that we have to be minimum 2 hours outside to prevent myopia, right? So here you have it. But I have less than I need in my glasses. But I love them. I love them. They're part of me now. So I have emotional attachment, I have to confess.
that I love that. We concluded with a confession, but I always say in that case, and we didn't talk about this ahead of time, guys, just so you know.
No.
But I always say you can also improve your vision and have plano glasses just for style purposes, and they don't have any diopters in them. So, and my mom said that too when she had a cataract surgery, and she just turned 86. And she said, I don't like myself without glasses. You see, like all my, you see, and, but I always say, like you said, weaker diopters, and to me, it's the freedom of living my life to the fullest. And that's what the food comes down to. I don't want to be sitting in a chair or not being able to move. And that's why I do yoga and all these, keep myself healthy in mind and body and in eyesight. It's like, so I can do cool stuff. I don't want to be limited. And that's what glasses, to me, a style accessory is a different thing than a handicap where you kind of cannot function, without that device, so to speak. So that's two different things. Yeah.
But since I know you, look what I have, and I can tell you, I test myself quite regularly. I can see that when I'm working less, when I read less, I see much better than it's of course it's subjective, not objective, but or when I stare a lot in the phone, it's just my own anecdotal experience, but I can see the shift. And actually I find it because one day I was really, I never look in the bed in my phone, but that morning I did. And because I need to finish something, and I was on the phone, I think 1.5 hours when I woke up. And I have this habit always to go on the scale. This is just, I have it. I like to know that I'm still the same. And I couldn't see the number. I say, wow, is this true? Because I was hour and a half on the phone. Now my vision is hazy. It's like, wow, that's really,
that's a lot of
strain, tired.
Mm-hmm. Yeah, that's a lot of strain. And like you said earlier, our eyes were not meant to, the studies with the sunlight, the natural light. And, it's not like that we can't look up close, but we are not supposed to do this all day long. Anyway, I know you have to go. You have to pick up your kids from school. And I really appreciate you coming on and sharing this. And if there's more questions on YouTube, if there's any questions I cannot respond to, I will send them, and I will put all the links into the show notes. And so that way you can, everybody can read up on those studies. And I'm like you, I'm so excited. And to me, I want to live like, I'm going to be 61 next month. I want to do cool stuff when I'm 91 or 101,
That's
so
great.
And think about eyesight.
Thank you so much, Claudia. I really enjoy that. And I just pick things I think it's important. It's much more, but at least the connection of the eye and the whole body, I think is very important to recognize. Because, thank you so much.
Anyway, well, we're going to stop the YouTube live. I will see everybody on YouTube next Wednesday, and we will talk about habits and goals. And that is directly related to our topic in January, which was setting a vision for your eyesight, a vision for your life. To me, your life vision is connected to how you see, for a lot of different reasons. So we're going to conclude that with habits. And that also ties in beautifully in what we did today, because how can you establish healthy habits and make them super solid and also connect that to goals? All right, everybody on YouTube, we will end the live stream now, and I will see you next week.